Welcome to the deep dive, where we really get into the nitty-gritty.
Yeah.
We're tackling the 2024 ADA Standards of Care revisions today.
Awesome.
And we're kind of assuming you're already in the know, about diabetes.
Right.
So we're skipping Diabetes 101 and jumping right into the stuff that matters most to you.
Exactly. The American Diabetes Association has been updating their standards since way back in 1989.
Wow.
And these 2024 revisions, man, they're full of insightful changes, really reflecting the latest in diabetes care.
So much has changed.
It really has.
There's a ton to unpack here, but don't worry, we'll help you sift through it.
Absolutely.
We're going to focus on what really matters for anyone who wants to stay ahead of the game.
One of the first things that really stood out to me was the emphasis on language.
But they talk about things.
Yeah. The ADA is seriously committed to person-first language now.
Oh, yeah. They're all about putting the individual first. Instead of saying a diabetic,
Right.
they say a person with diabetes. It seems small, but it's a huge shift in terms of respect and, empowerment.
Couldn't agree more. And that focus on the individual, it's woven throughout the new standards.
I see that.
Take their approach to diagnosis and classification.
Okay.
There's a new focus on diagnosing diabetes first and then classifying it.
Oh, interesting. So it's okay, we know you have diabetes. Now let's figure out the specifics.
Yeah,
to give you the best treatment.
Precisely. And that's where the A1C testing comes in. They're prioritizing it big time in these guidelines.
I bet a lot of our listeners are already familiar with A1C, but just to recap,
Sure.
it's basically the main test for diagnosing diabetes and prediabetes these days.
Yep. A1C gives us a really good overall picture of blood sugar control.
Right.
But, there's still some debate about whether it works as well for certain groups of people.
So it's not perfect.
Not perfect, no. But it's a cornerstone of diagnosis and management for sure.
Okay. So you're diagnosed, and then they figure out which type of diabetes you have.
Exactly. And getting that classification right is really important because...
It impacts your treatment plan.
Absolutely. Type 1, type 2, other specific types. Each one needs a different management plan. It's all about personalized care.
Speaking of type 1, there's a new drug, teplizumab, that's been approved to delay the onset.
Oh, yeah. Teplizumab is showing a lot of promise.
Really?
It's the first therapy that can actually delay the progression to stage 3 type 1 diabetes in people who are at risk.
Wow, that's huge.
It is. Imagine being able to put off needing insulin and all the daily challenges of type 1 diabetes, even for just a few years. It's a big deal.
It really is.
But realistically, it's a very expensive treatment, and it's not available everywhere yet. And there's still a lot we don't know about long-term effects or if people might need retreatment later on.
So it's a big step forward, but...
Yeah, it's not a cure-all, and there are things to consider.
Another area that I found interesting was the focus on bone health.
Bone health.
Yeah. I wouldn't have automatically connected diabetes and bone health, but it turns out there's a strong link.
It might seem surprising, but people with diabetes actually have a higher risk of osteoporosis and fractures.
Really?
Yeah. And these new standards are pushing for regular bone health checks.
That makes sense.
And being proactive about managing those risks.
So it's about looking at the whole person, not just their blood sugar.
Exactly.
And that makes me wonder, what about other areas, like liver health? Did they touch on that?
They did. There are updates on liver disease, especially non-alcoholic fatty liver disease, or NAFLD.
Okay.
Where fat builds up in the liver.
Yeah.
It's becoming more common in people with diabetes, and these new standards offer guidance on screening and management.
So early detection is key.
Exactly. And lifestyle changes.
So it seems like personalized care and early intervention, that's a big theme in these updates.
You got it. And the updated section on lifestyle and well-being, it really reflects that shift. Well, it moves away from dictating what patients should do.
Okay.
And focuses more on guiding healthcare professionals on how to better support their patients.
So it's less about saying you should do this and more about working together.
Exactly.
What about changes to diabetes, self-management, education, and support?
Oh, DSMES.
Yeah.
There's a big change there. They're acknowledging telehealth and digital interventions now.
Makes sense in today's world.
Right. It's a much more modern approach that makes DSMES more accessible to everyone.
I like that.
Especially with how digital everything is becoming.
Did they mention anything about nutrition recommendations?
Oh, definitely. They're advocating for an inclusive and personalized approach to nutrition.
Meaning?
Moving away from those rigid meal plans and focusing on food-based eating patterns.
So finding what works for each person.
Exactly. Taking into account cultural preferences and individual needs.
So it's less about strict carb counting and more about finding ways to eat healthy that you can actually stick with.
Precisely. And they even included a new section on chrononutrition.
Chrono what?
Chrononutrition.
That's a new one.
I know, right?
What is it?
It basically looks at the impact of meal timing.
Like when you eat.
Yeah. Interesting. For example, some research suggests that eating earlier in the day might be better for blood sugar control.
But it's still early days.
No, yeah, it's a pretty new area of research. We need more studies to really understand the long-term effects.
So it's not just what you eat, it's when you eat too.
Right. That's something to think about.
And speaking of how meal timing and food choices affect blood sugar,
Yeah.
it makes me think about hypoglycemia.
Ah, yes. A big concern for anyone with diabetes.
For sure. And the new standards have a whole dedicated section just on hypoglycemia.
They do. It highlights how important it is.
And I see they're really promoting continuous glucose monitoring, CGM, for preventing and managing hypoglycemia.
Absolutely. CGM is a game changer. It's like having a window into your blood sugar 24/7.
Which can really help avoid those dangerous lows. I'm sure a lot of our listeners are already familiar with CGM.
Yeah, probably.
But it's worth noting that the ADA is recommending it be used early on.
Oh, definitely. Ideally, even at the time of diagnosis, especially for type 1 diabetes.
They're really backing CGM.
They are. They see its value.
But what about cost and access? Those are still barriers for a lot of people, right?
You're right. CGM technology has come a long way. It's more affordable than it used to be, but access and affordability are still issues for some people. Insurance coverage isn't always great, and the out-of-pocket costs can be a lot.
There's still work to be done there.
Definitely.
So we've talked about person-first language, diagnosis, type 1 diabetes updates, bone health, liver disease, lifestyle and well-being, hypoglycemia, and CGM.
It's a lot.
We've covered a lot of ground.
We have.
But it feels like there's still so much more to explore.
There is.
Like obesity and weight management.
Right. It's a big one.
And how important it is for managing diabetes.
Absolutely. Our understanding of that is constantly evolving.
Well, this is the deep dive.
That's right.
Let's keep going.
Let's do it. It's amazing how much our understanding of weight management's role in diabetes has changed.
It really is.
The 2024 standards, they really put a spotlight on how crucial it is.
Yeah, and it seems like they're not just looking at BMI anymore.
Right, they're pushing for a more, well-rounded assessment, including anthropometric measurements like waist circumference and waist-to-hip ratio.
So, it matters where you carry the weight.
Exactly.
Why is that so important?
Well, where your body fat is distributed, it actually plays a big role in diabetes risk and management.
How so?
Like if you carry a lot of weight around your abdomen, what they call visceral fat.
Yeah.
That's been linked to a higher risk of insulin resistance and type 2 diabetes.
Oh, interesting.
So these extra measurements, they give us a better understanding of a person's body composition and their risks.
Got it. So what are they recommending for weight management? Like what strategies?
The focus is still on personalized strategies, tailored to each person.
Okay.
But they're really highlighting GLP-1 receptor agonists and those newer dual GIP and GLP-1 receptor agonists.
Those are a mouthful.
I know, right?
Can you break those down for me? What's the difference?
Sure. So both of them, they basically work by mimicking hormones that help regulate blood sugar and appetite.
Okay.
GLP-1 receptor agonists, they mainly target the GLP-1 receptor.
The dual agonists.
Those target both GLP-1 and GIP receptors, so they might have even stronger effects on blood sugar and weight loss.
Oh, they help manage blood sugar and help with weight loss.
Exactly. It's a win-win.
That's great.
And that kind of leads us into the whole discussion of pharmacological approaches.
Like medications.
Yep.
What are some of the key updates there?
Well, there's a big change regarding insulin.
Really?
They're now saying they prefer insulin analogs or inhaled insulin over injectable human insulins.
Why the change?
Mostly to reduce the risk of hypoglycemia, those dangerous drops in blood sugar.
Makes sense. Safety first.
Right. And these newer insulins, they tend to be more predictable.
Yeah.
So they can help prevent those blood sugar dips.
Anything else that stands out in terms of medications?
They're really emphasizing personalized treatment goals and using combination therapy early on, if needed.
So recognizing that everyone is different.
Exactly. Diabetes management isn't one size fits all.
Are there specific medications they recommend?
Well, for people at high risk of heart and kidney disease, they recommend prioritizing medications that can reduce those risks.
So looking at the big picture, not just diabetes.
Exactly. Taking a holistic approach.
Which brings us to those specific areas: cardiovascular, and kidney disease. Any major updates there?
There are some interesting developments with statin intolerance.
Statins, those are for cholesterol, right?
Yep. They're often prescribed to lower cholesterol,
Oh,
but some people, they get side effects that make statins hard to take.
I see.
And these new standards, they specifically mention bempedoic acid as an alternative.
Good to know, especially since high cholesterol is such a risk factor for heart disease.
For sure. They also have more detailed guidance on managing heart failure in people with diabetes.
Okay.
They're emphasizing the use of SGLT2 inhibitors.
Those are popping up everywhere.
Right. They're really showing a lot of promise for heart and kidney health.
It's exciting to see new treatments emerging.
It is. And they also talk about monitoring kidney function for people on certain medications.
Because some meds can affect the kidneys.
Exactly. It's all about being proactive and catching problems early.
So we've talked a lot about diabetes care for adults.
Yeah.
What about kids? Any changes in pediatric diabetes care?
Oh, yeah. The children and adolescents section, that's got some big revisions.
Like that. Fill me in.
Well, they're recommending early use of insulin pumps or automated insulin delivery systems in kids with type 1 diabetes.
Wow, that's a big change. They're really embracing technology.
They are. It's about recognizing how much these technologies can help kids and their families manage diabetes better.
Makes sense. Fewer complications, better quality of life.
Exactly.
Any other notable changes for kids?
They added recommendations for addressing substance use in children and teens with diabetes.
Oh, wow. That's important.
It is. Substance use can really mess with diabetes management, so it's good that they're addressing it.
What about managing diabetes during pregnancy? That seems like another area with unique challenges.
Absolutely. Pregnancy can be tough for anyone with diabetes.
For sure.
The standards really emphasize preconception care for anyone who might get pregnant.
So planning ahead.
Exactly. Getting things under control before pregnancy to reduce risks for both the mother and the baby.
And once someone is pregnant, what then?
They updated their recommendations on using CGM during pregnancy.
So continuous glucose monitoring during pregnancy too.
Yep. It can really help pregnant women keep their blood sugar in a good range.
Which is so important for a healthy pregnancy.
Exactly. But, these are just recommendations. The specific approach will depend on the individual and what their doctor says.
Right. Personalized care.
Always.
We've covered so much in this deep dive. Person-first language, new technology, medications.
It's a lot to take in.
It really feels like these 2024 standards of care are pushing diabetes management forward in a big way.
I think so, too. There's definitely a sense of progress.
And a focus on giving people with diabetes the tools and support they need to live their best lives.
Absolutely.
Okay, so we've covered a lot about diabetes care in general.
We have.
But what about in the hospital?
Oh, yeah, that's a whole other ballgame.
Right.
Managing diabetes in the hospital, it can be really tricky.
I bet. Lots of challenges there.
Yeah, for both patients and healthcare providers.
Well, we've got to dive into that.
Let's do it.
So managing diabetes in the hospital, it can get pretty complex.
You're telling me.
Different routines, unfamiliar foods, medication changes,
Yeah, it can throw a wrench in even the best diabetes management plan.
So how do these new standards tackle that? How do they ensure good diabetes care in the hospital?
Well, the big thing is personalized care. They're really pushing for that.
Makes sense. You can't have a one-size-fits-all approach in a hospital.
Exactly. Every patient is different with their own history, their own beds, their own needs.
So how do they make sure that happens? That each person gets the right care?
They want hospitals to have clear protocols in place.
Okay.
And to review them regularly.
So there's a plan for how to manage diabetes, no matter why someone's in the hospital.
Right. Whether it's a planned surgery or an emergency visit, there should be guidelines to help the staff manage their diabetes.
And those guidelines need to be up to date, right?
Absolutely. Diabetes care is always evolving, so hospitals need to keep up with the latest research.
I'm also seeing a lot about technology in these standards.
Yeah.
Like encouraging hospitals to use the tools that people are already using at home.
Exactly. They specifically say that hospitals should let patients keep using their own CGM devices if it's clinically appropriate.
Which seems obvious, right?
Right.
If you're already using CGM at home, why not in the hospital where you might need even closer monitoring?
Right. It just makes sense.
And it's not just about allowing CGM.
No, they're even open to using automated insulin delivery systems or aid systems along with CGM.
Wow.
Of course, that would only be if it's safe and appropriate for the individual patient.
But it's a big step that the ADA is supporting these technologies in hospitals.
It is.
But I imagine there are challenges to actually making that happen.
Oh, yeah, definitely. There's the whole logistics of it, integrating new technology into hospital systems, training staff, figuring out privacy concerns.
It's complicated.
It is, but the fact that the ADA is endorsing it, that's a huge push towards getting these technologies more widely used.
And it shows that they believe in these technologies, that they can really improve diabetes care.
Exactly, even in a complex setting like a hospital.
So beyond the tech stuff, what else do the standards say about diabetes care in hospitals?
They give more specific guidance on blood sugar targets for hospitalized patients,
Okay.
recognizing that really tight control might not always be possible.
Or even so.
Right, especially for people who are really sick.
So it's about finding that sweet spot, managing blood sugar, but also avoiding hypoglycemia.
Absolutely. Hypoglycemia can be really dangerous in the hospital.
Then they mentioned SGLT2 inhibitors again,
They do.
specifically for patients with heart failure.
Yep. They recommend that people keep taking those medications while they're in the hospital and after they're discharged, unless there's a reason they can't.
So much to consider.
I know, right?
We've covered a ton of ground in this deep dive.
We have, from person-first language to the newest technology and medications.
It feels like these 2024 standards of care are a real step forward in diabetes management.
I agree. There's a sense of progress and a focus on empowering people with diabetes.
And the healthcare professionals who care for them.
Exactly.
So if you had to pick one key takeaway for our listeners, what would it be?
I think it's the emphasis on personalized care.
Individualized care.
Yeah. The ADA is moving away from those one-size-fits-all approaches and recognizing that managing diabetes is not a static thing.
It's a journey, and everyone's journeys are different.
Right. It's about understanding individual needs, using the latest technologies and treatments, and having patients and healthcare providers work together as a team.
I like that.
Yeah.
And for anyone who wants to learn more, I definitely recommend checking out the full Summary of Revisions document from the ADA.
It's a great resource.
We'll include a link in the show notes.
Perfect.
This deep dive was really just a glimpse into all the updates.
Yeah, just scratching the surface.
But it's a good starting point for staying informed about the latest in diabetes care.
Definitely.
As we wrap up, I want to leave you with a thought.
Okay.
With all these advancements we've talked about, what do you think the future of diabetes care looks like? What exciting breakthroughs are coming? And what challenges do we still need to face?
Those are great questions.
Keep those questions in mind, and let's keep this conversation going.
Absolutely.
That's all for this deep dive. Thanks for joining us.
Thanks for having me.